Let's talk about how our bodies process drugs. It's not always the same. The way our bodies handle medications can change over time. This is called time-dependent pharmacokinetics. Understanding this is crucial for pharmacists. By understanding how drug processing changes, we can optimize drug regimens for our patients. This means figuring out the best dose and the best time to take medication. Ultimately, it's about making sure the medicine works as effectively as possible. Imagine you have a headache and you take an over-the-counter pain reliever. The way your body breaks down and uses that pain reliever can be different depending on the time of day you take it. It can even be affected by whether you've eaten recently. Factors like your age, what you eat, and other medications you take can all influence time-dependent pharmacokinetics. For example, as we get older, our organs might not work as efficiently. Time-dependent pharmacokinetics can be broken down into two main types: chronopharmacokinetics and chemically induced time dependency. Let's break down these big words. Chronopharmacokinetics is a fancy way of saying that the effects of a drug can vary depending on the time of day it's taken. This has to do with our body's natural rhythms, like our sleep-wake cycle and hormone fluctuations. Chemically induced time dependency refers to how other substances in our bodies, like enzymes and receptors, can affect a drug's behavior over time. Think of it like this: certain drugs can either boost or block the activity of enzymes, which are responsible for breaking down medications. This can alter how much of a drug is actually available to our bodies and for how long. Understanding these different types of time dependency is essential for healthcare professionals. By recognizing these factors, we can tailor medication regimens to individual patients, maximizing their benefits while minimizing potential risks. For instance, certain medications are best taken in the morning, while others are more effective at night. This is why understanding chronopharmacokinetics is so vital. Our bodies operate on a roughly 24-hour cycle called the circadian rhythm. This internal clock influences various physiological processes, including hormone release, body temperature, and even our sleep-wake patterns. What's fascinating is that this circadian rhythm can significantly impact how our bodies respond to medications. This is where chronopharmacokinetics comes into play. Think of it as the interplay between our body's internal clock and drug effectiveness. For example, some medications are absorbed more efficiently in the morning, while others might reach peak effectiveness if taken at night. This is because the rate of drug absorption, distribution, metabolism, and elimination can fluctuate throughout the day, influenced by our circadian rhythm. Understanding these rhythmic changes is crucial for optimizing drug therapy. By timing drug administration in sync with our body's natural rhythms, we can enhance drug effectiveness and potentially reduce side effects. Let's look at some real-life examples of how chronopharmacokinetics plays out with common medications. Take aminoglycosides, a type of antibiotic. These medications are most effective when our kidneys are working at their peak. Since kidney function tends to be highest during the day, dosing aminoglycosides in the morning can enhance their effectiveness. Another example is NSAIDs like ibuprofen or naproxen. Many people experience peak pain levels at night. Taking NSAIDs later in the day can help manage pain more effectively. Blood pressure medications are another interesting case. Our blood pressure naturally dips at night. Taking certain blood pressure medications at bedtime can help control blood pressure throughout the night, reducing the risk of heart attacks and strokes. These examples highlight how crucial it is to consider the timing of medication administration. By working with our body's natural rhythms, we can optimize drug therapy and improve patient outcomes. Section 5. Chemically induced time dependency, enzymes and receptors. Now let's dive into chemically induced time dependency. This is all about how other substances in our bodies, specifically enzymes and receptors, can influence how a drug behaves over time. Enzymes are like tiny workers that speed up chemical reactions in our bodies. Some drugs can either increase or decrease the activity of these enzymes, impacting how quickly a drug is metabolized. This is called enzyme induction or inhibition. Think of it like this. If a drug induces an enzyme, it's like putting more workers on the assembly line, speeding up drug breakdown. Conversely, inhibiting an enzyme is like slowing down the assembly line, leading to slower drug metabolism and potentially increased drug levels in the body. Receptors, on the other hand, are like docking stations for drugs. Drugs bind to these receptors to exert their effects. However, prolonged exposure to certain drugs can lead to changes in these receptors, making them more or less sensitive to the drug. This is known as receptor regulation. Understanding these intricate interactions between drugs, enzymes, and receptors is paramount for pharmacists. It allows us to anticipate potential drug interactions, adjust dosages accordingly, and ensure optimal therapeutic outcomes for our patients. Section 6. Drug interactions, a complex dance of chemicals. Drug interactions occur when the presence of one drug modifies the effect of another drug in the body. This can happen in several ways and can either increase or decrease the action of one or both drugs. One common way drug interactions happen is by affecting the way drugs are absorbed into the bloodstream. Some drugs can bind to others in the gut, preventing their absorption and reducing their effectiveness. Once in the bloodstream, drugs are distributed throughout the body. Some drugs can compete for binding sites on proteins in the blood, affecting their distribution and potentially leading to higher levels of unbound active drug. Metabolism, primarily handled by the liver, is another key area for drug interactions. As discussed earlier, some drugs can induce or inhibit enzymes responsible for drug breakdown, altering the rate at which drugs are metabolized and eliminated from the body. Finally, drug interactions can also affect elimination, mainly through the kidneys. Some drugs can block or enhance the excretion of others, leading to either a build-up or a faster clearance of certain medications. Understanding the mechanisms of these interactions is crucial for pharmacists to prevent adverse events and ensure safe and effective medication use. Section 7. Drug interaction examples with numerical problems. Let's illustrate drug interactions with a couple of practical examples. Imagine a patient taking warfarin, a blood thinner, is prescribed a course of antibiotics. Some antibiotics can interfere with warfarin's metabolism, leading to higher levels of warfarin in the blood. Let's say a patient on warfarin has an INR, a measure of blood clotting time, of 2.5, which is within the therapeutic range. If an interacting antibiotic is started, the INR could increase to 4, significantly raising the risk of bleeding. Another example is the interaction between grapefruit juice and certain cholesterol-lowering medications, like statins. Grapefruit juice inhibits an enzyme responsible for statin metabolism, leading to higher levels of statins in the body. Suppose a patient taking a statin with a low risk of muscle side effects starts consuming grapefruit juice regularly. In that case, the statin levels in their body could increase, potentially elevating the risk of muscle pain and damage. These examples emphasize the real-world implications of drug interactions. Pharmacists play a vital role in identifying potential interactions, educating patients, and adjusting medication regimens to minimize risks and optimize therapeutic outcomes. Section 8. Conclusion: the importance of understanding drug behavior. In conclusion, understanding time-dependent pharmacokinetics is paramount in modern pharmacy practice. The way our bodies handle drugs is not static. It changes over time due to various factors, including our body's natural rhythms, interactions with other substances, and individual patient characteristics. By grasping the principles of chronopharmacokinetics, recognizing the impact of enzyme and receptor interactions, and staying vigilant about potential drug interactions, pharmacists can significantly enhance patient care. Timing drug administration to coincide with our body's natural rhythms can optimize drug effectiveness and potentially reduce side effects. Recognizing how drugs interact with each other, both at the enzyme and receptor levels, is crucial for preventing adverse drug events and ensuring patient safety. As medication regimens become increasingly complex, pharmacists' role in navigating these intricate interactions becomes even more critical. By staying informed about time-dependent pharmacokinetics, we can empower ourselves to make informed decisions that ultimately lead to better patient outcomes.